Good afternoon. Once more. I had such utmost faith in the All India Ophthalmology Society's online speaker-ready room. And so I did not even check if my talk was on. And but I first want to thank Prashant Bavankule, ARC chairman, who is not here, who is on his way, for giving me the opportunity to curate a program like this one. And for all the speakers to enthusiastically, some of course after a lot of harassment for participating. But particularly I thank Carl for initiating me into this whole faculty development, education way back in the good old ICO days. So this is actually about, this segment is about evaluating how good your trainee is. So we have clinical evaluation, we have evaluation of surgical skills, and then we also have evaluation of how good your training program is doing. And then after all that, then you give feedback. And you heard from Dr. Helena about feedback, and you're going to also hear from Carl about feedback. So my role here is to talk to you about how to do clinical skills evaluation in a really busy clinic. We're all busy. We have to finish patients on time, then we have to run for classes, and then of course we have to at some point go home. And so how do you do this in a busy clinic? So the objectives of my talk are introduction, recap of the OCEX, the Ophthalmic Clinical Evaluation Exercise, and experience with barriers, solution to OCS implementation in a busy clinic. What are these other things, the other tools, Mini CEX, DOPS, and IDOCS? So the OCEX, as I understand, was Dr. Carl's thesis way back, which was published in 2004. And the second 2.0 was published in IGO in 2021. So what exactly is the ophthalmic clinical evaluation exercise? It is an observed encounter between a resident and a new patient. The evaluator should be present in the exam room for the entire interaction. The intent is to rate the resident in all the categories listed below and then provide immediate performance feedback. I know some of you are already thinking, right, observed encounter in a busy clinic, but let's see how to go about it. So first, let's get familiar with the OCEX, okay? So it is a rubrics-based system which makes the assessment objective. So if you look at the components, look at the first is the interview skills, which include introduction, chief complaint, history of present illness. Some of this is unique to other countries, like pain inquiry, we don't ask. All the patients will have pain. And then allergies or adverse reactions to medications, review of systems, and then past systemic history, past ocular history, social history, habits, and family history. And then you, of course, have examination skills, which include, you start off with hand hygiene. And then there is visual acuity, pupils, visual fields, motility, external exam, slit lamp, intraocular pressure, fundoscopy. And if you look to the right, you have a rubric which helps you score them. So that at that day, in that mood, whether you're in a good mood, whether your resident is irritating you and you're not scoring them, poorly or fairly. There's a novice, a beginner, and competent. And there is a description for each one of these. So you just look at that, look at the performance, and then score. Most important, often neglected, are the interpersonal and communication skills, which look at patient comfort, empathy, respectfulness, explanation of findings, explain the diagnosis, explain options and the plan, and ask the patient if they had any questions. All this your resident is doing while you are observing. Okay? And finally, they summarize this whole thing and present it to you as a case presentation. This is very important for exam, for their final exam. Okay? So, and then you give the feedback, write down the feedback, make the residents sign that they have read it, they've understood, and you sign and then give it to them, dated. So you're wondering how often, how frequent, how do I have time to do all this? Who is going to do it? So I'm not going to do the scoring part because, I have a video like this playing and then I give you the sheet and then say, why don't you score it? I've asked them to check the pupil, and this is the pupil check going on. So if you are a trainer, how would you score this? Is it does not check, does part of the pupillary exam correctly, or checks light reaction and RAPD, size, symmetry, and uses correct technique? What do you think? You think this person is a novice, beginner, or competent? Beginner. So something like this. So you would use this to train your faculty. Examples like this. And here's one more, it looks as ocular motility. So I said test the ocular motility, and this is what the resident does. And then I said, it's over? He said, yeah, it's over. But where is the cover test? Okay? It does look more like a dancing eyes sort of thing. So is this person a novice, beginner, or competent? Somewhere between novice and beginner. Checks movements incompletely or with incorrect technique in some aspect. Correct? So that's how you will use. And why do you use a rubric? Why do we need this? Because teaching is not equal to learning. So really, who needs an evaluation of their clinical skills with an OCEX? Ophthalmology residents, medical students during the ophthalmology rotation, subspecialty fellows at the start of their training. You want to know how much ophthalmology they know before they start their subspecialty. Allied specialty residents in Shankar Nethralaya, we used to have, sorry, that's different. We used to have people from neurology or medicine who come and observe you, who have come for a month of ophthalmology. You want to know, make sure they understood basic ophthalmology techniques. Optometry trainings, ophthalmic nurse technician trainees, all of them, the OCEX can be applicable. So when do you want to do this during the training? So the OCEX comes under a category called the workplace-based assessment. Okay, it's done in real life in their workplace. So it can be used as a formative assessment, which means you can use it at the end of the first year to see what they've learned. You can also use it as a summative assessment to see, hey, is my trainee ready to go for the exam? Okay, where maybe it's trainee ready to go for an FRCS exam, where everything, the exact technique is supervised, is looked at and graded. So you can use it either formative or summative. So how did I do it in Shankar Nethralaya? So I would do it on my off day, my academic off day, and this was already scheduled. Which resident will have their OCEX? So the secretary informs the resident and informs the faculty with who the resident is posted, saying, this resident is going to be gone for about 90 minutes. And then the resident shows up, and then I'm just sitting quietly, and then I tell the patient, so the resident is in the white coat, and I tell the patient that this is a quality check. So residents and the patients often don't mind. You say, tell them, I thank you for your time. It's going to be, and ours is a private hospital. So you can't just drag some patient and make them sit and ask the patient will think they're experimenting on them. You're learning on me. I am guinea pig. No, you tell them this is a quality check. This doctor is the future doctor. From next year, he's on his own practicing. He's going to be operating on you later. So this is a quality check. They are usually understand. I've never had a patient who have said no. So explain this to the patient, and then the resident starts, and then I just sit in a corner and observe the whole encounter. And including refraction, including retinoscopy, all of it. I always, in Shankar Nethralaya, had the refraction rechecked. But you have to watch the whole thing and then have them present it to you, okay? So anyway, so this is how it happens. Sometimes, occasionally, we will also have them record and present it to me, the encounter. So the potential barriers to OCS implementation are the assessor's time, assessor's training, other faculty cooperation, from whom the posting they're relieved and they come to you for 90 minutes, they have to buy in. And then the trainee availability and feedback and follow-up. So the OCEX is a great multi-purpose tool. It's a great tool for assessment, good tool to teach with. Professionalism and communication can also be assessed, and you can know whether your trainee's exam preparedness. There are also mini CX available, a short episode of real student-patient interaction with the workplace. There are mini CX which only looks at each one of these. And then this has been studied. The reliability has been studied. There I found a very good one, mini CX for just strabismus evaluation. You can also make your own mini CX. Just make sure that that inter-rater reliability has been established. Okay. There is something called DOPS, which is also part of the workplace-based assessment. This is observation, evaluation of a procedural skill, okay, by a trainee on a real patient. And again, you do the assessment, evaluation of a specific patient encounter. Did they do informed consent? Did they explain to the patient what they were going to do, etc., etc. And then you give them feedback. That is key. This is an example for DOPS, I think is adopted from the Royal College. RC off the DOPS example. And then you have the MSF, which is again a multi-source feedback, a complete topic in itself, which is called the 360-degree evaluation, where you get evaluation you get feedback from not just the faculty, but the patients, the peers, students, nurses, staff, because they may be showing good attitude to you, but they may be harassing others. So you could also have case-based discussions, also part of clinical evaluation, assessment. And there are many, many types of case-based discussions. And then we finally have something called the IDOCS, which is International Direct Observation of Clinical Skills for Subjective Refraction. This is again broken down into steps. In conclusion, there are many tools available for clinical evaluation of skills in the clinic. We looked at the OCX in great detail. They belong to the broad umbrella term of WPBAs, workplace-based assessments. The OCX has an application in a wide variety of settings to evaluate many categories of healthcare professionals. If you just, with a little bit of imagination, you can incorporate it into your program. It will give you immense feedback about your trainee, where you need to be focused. It will give immense feedback to the trainee, where they are and where they need to focus. Thank you so much.